Hi, I'm Mike Detchen. I'm the Chief Operating Officer for Mobile Heartbeat. We provide enterprise software platforms that allow hospitals and healthcare systems to communicate and collaborate across their care teams. One of the foundational principles we had from the very beginning was that a communication platform needs to support all the different users involved in patient care. And we think there's exponential value to be provided the more users you have on the platform. So we've put a ton of emphasis on adoption and enterprise value from the very beginning. That translates to the software we develop, the capabilities we provide, how we implement the software to ensure that you have true enterprise adoption. One of the mistakes we see out there is that sometimes there's solutions that are focused just on physicians or just on nurses. And when you think about today's healthcare environment, it's very much multidisciplinary, right? There's lots of different roles that impact the patient care. And we want to make sure that all of them have the ability to communicate around that particular patient. So, we focused on that from the very beginning. And one of the things that we find really interesting and exciting is that once we're implemented, we end up having this really rich data set that allows us to understand exactly who is communicating with who. And we use that for a few different things. We use it to kind of drive further adoption, right? Sometimes we hear that physicians only want to talk to other physicians, while the data might say that 60 or 70% of the time, the physicians are talking to nurses or ancillary staff, right? So we are able to use that to dispel some myths. We also use it to drive workflow and process improvements, which eventually lead to better patient care. Right. And so what we found when we do all of this is that we're able to drive improvements, through all these connection points that we're making across the caregivers. We're able to drive improvements in patient throughput. You see, length of stay reductions. We're seeing, process improvements, whether it's lab turnaround times or stroke to CT scan, or it's discharge order to discharge, right? All these improvements lead to kind of macro level kind of efficiencies across the hospital and an overall better patient experience. We'd love to share more with you about how we drive enterprise adoption for our customers, and then how we actually use the data from that adoption to drive workflow improvements and benefits for not only the healthcare system, but the patients as well.